Cookeville Regional Medical Center, the Upper Cumberland's proven choice for healthcare. Here's Jill Bolling.
We've all heard that the heart is the most vital muscle in the body, but have you ever considered what it takes to keep this muscle running with exact precision? We're currently in the cardiac catheterization lab at Cookeville Regional Medical Center, and in part one of this two-part series, we're going to take a closer look at the cardiology services at the Heart Vascular Center and the lengths that we go through to make sure that your heart is beating strong.
Time is muscle when you're having a heart attack, and every minute counts. Know the warning signs of a heart attack and be sure you act quickly. Dr. Alex Case provides important information you need to know.
Time is muscle, that's right. So when the heart attack starts, there's an occluded artery. And so until that artery is opened up, either by medicine or most commonly with a stent or balloon, then damage is occurring to the heart muscle. And that damage is irreversible. So the sooner the patient gets to the emergency room, the sooner we can start helping them. Signs and symptoms would include any kind of discomfort in between your jawbone and your upper abdomen. Those would be the classic symptoms. It might be tightness or pressure. A lot of times patients expect it to be a pain, but it rarely is a pain until the late stages of a heart attack. Now, not everybody has classic symptoms, especially women, and they may have very atypical discomfort in their chest, or people may have discomfort just in their elbows, or maybe just shortness of breath. And diabetics also often don't have chest discomfort as well, maybe just shortness of breath. Dial 911, and we're working with the paramedics in this whole region to bring the patients here so they can get definitive care for their heart attack. We're the only center in between really Nashville and Knoxville where you can get a balloon or a stent for your heart attack, and that is the treatment of choice to get the artery open.
When you're having a heart attack, there is no safer place to be than the Upper Cumberland region. Dr. Stacy Brewington explains the life-saving Code 37 protocol.
Code 37 is what the state EMS uses to identify someone who's having a heart attack. So if a patient dials 911 and tells them they think they're having a heart attack, the dispatcher will send the ambulance to their house and tell them Code 37. That's ambulance talk, where we think they're having a heart attack. So we borrowed that term from them and implemented Code 37 within the hospital. So when the emergency room doctor recognizes an acute heart attack based on the EKG and the symptoms in the emergency room, he makes one phone call to the operator who pages a Code 37 to all the doctors and nurses and technicians who would be involved in doing a sudden angioplasty. Our average door-to-balloon time for last year was around 60 minutes. If the paramedics call and let us know that they're bringing someone in who's having a heart attack, and we confirm that when they arrive at the emergency room, so far this year that average is about 35 minutes. So we've been able to really cut time off of our door-to-balloon time, which saves heart muscle, which helps people live longer, which saves lives.
From angioplasty to stents to pacemakers, the Heart and Vascular Center does it all. Dr. Bunker Stout explains.
Well, Cookeville Regional is the only hospital in the Upper Cumberland, and we serve a very large area that performs angioplasty. We also have the ability to do other procedures to help us determine the significance of a blockage. So there's a procedure called IVUS, which is intravascular ultrasound imaging, where we insert a little probe down the artery, and we actually look at the inside of the artery, the lumen of the artery, with an ultrasound probe to determine how significantly blocked the artery is. There's also a procedure called a flow wire, where a wire goes down the artery of the heart, and we measure flow before and then after the blockage again to help us assist to determine if angioplasty or stent will be needed. This is actually a patient we just finished doing, and he presented with some complaints of exertional shortness of breath and actually some dizziness. And this artery on the back of the heart, called the circumflex, actually has two areas of narrowing, one right here and the second one right there. So we treated that by using a single stent to cover both areas of blockage. This is the segment artery now with the stent. You can see this it's wide open and no area of narrowing. Well, Cookeville Regional is very fortunate to have exceptional nurses on the floors in that emergency room, operating room, and here in the cath lab. So the nurses are, I think the patients will tell you probably more than any other personnel that the nurses are probably the most outstanding feature of Cookeville Regional Medical Center. The nurses give them a lot of individualized care. The patients feel like they're a person and not a number.
Many are not aware that the heart has an intricate electrical system that keeps everything in perfect rhythm. The Heart Vascular Center is pleased to announce a new addition to the team, cardiologist and electrical expert Dr. Mark Wathen.
So I study the electrical physiology of the heart, or the electrical heart nature. And the EP program would include a specialist such as myself. And the things that electrophysiologists do vary from slow heartbeat treatment to fast heartbeat treatment. Treatments might be a pacemaker, might be implanted defibrillator, might be a simple electrical study of the heart called an electrophysiology study, or catheter ablation, where we can map and ablate or repair or fix or eliminate the fast heart rhythms. So one of the difficulties is just recognizing who has the danger and being able to treat them before they ever have it. And patients oftentimes expect pain or some other problem before they are taken to the physician or before they seek help. This is a situation where we need to understand the risk before there are any symptoms whatsoever. So it's a conundrum in a way, because you go all the way from no symptoms to mortality with this problem. And so it's a matter of the physicians understanding the risks and being able to refer patients appropriately to treat it, and patients being willing to accept the therapies that are associated with cardiac arrhythmias. Another important new feature that we're going to be doing here in Cookeville, we're going to add a ability to where a surgeon that does work on the outside of the heart will be combined in a hybrid procedure where I will do work on the inside of the heart to treat atrial fibrillation at once. That's something new. It's something that I did at Vanderbilt, something that I've been very interested in. So myself and Dr. Lewis Wilson here have plans in place to begin this hybrid approach. It's sort of one of the new frontiers, really, of arrhythmia care.
The team at the Heart and Vascular Center is ready to care for you 24/7, but they also want to encourage you to keep your heart healthy.
Don't wait and don't deny that you're having a problem. It may just be indigestion, but it's much better off feeling foolish and finding out that you had indigestion than finding out that you were actually having a heart attack and didn't seek attention.
I think what most patients need to do is eat less, eat more of the right foods, more fresh fruits and vegetables, and exercise more. A good rule of thumb is to exercise 30 minutes at a time, 3 to 5 times a week. Seeing your doctor regularly for checks on blood pressure, cholesterol, and diabetes is also very beneficial.
And always dial 911 if you think you're having a heart attack, because you'll get there faster and get care much quicker. The paramedics are able to do things that are very important on the way to the hospital.
In Cookeville Regional News this month, we would like to welcome several new physicians to our staff. Dr. Mark Wathen, Dr. Timothy Powell, and Dr. Don Barlow. Dr. Wathen specializes in electrophysiology, a subspecialty of cardiology, while Dr. Powell specializes in cardiothoracic and vascular surgery. And Dr. Don Barlow, an internal medicine physician, will be joining the hospitalist program at Cookeville Regional, focusing solely on taking care of patients who have been admitted to the hospital. The cancer program at Cookeville Regional Medical Center has been awarded the prestigious Outstanding Achievement Award by the Commission on Cancer. This award is designed to recognize cancer programs that strive for excellence in providing quality care to cancer patients. Only 18% of hospitals surveyed in 2009 received this award. The award represents this facility's dedication to leadership, data management, research, community activities, and quality improvement. Are you ready to get fit in 2010? If so, Cookeville Regional wants to help on your journey to becoming a healthier you. Call the marketing department at 931-783-2629 and mention this television show to receive a free pedometer. Be sure to tune in for part 2 of the Heart and Vascular Center series, when we will take a closer look at the heart surgery program at Cookeville Regional. As always, we appreciate you tuning in. Have a healthy and safe day.
Cookeville Regional Medical Center, the Upper Cumberland's proven choice for healthcare.